Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. Delighted to be back with you today. Of course, I am joined by the Medical Director of Infection Control and Infectious Disease, Dr. Dana Hawkinson, our outstanding physician, and Doc Hawk. We also have U.S. Senator Jerry Moran, who I think is going to be joining us from Washington, D.C. I know he's a bit delayed this morning by some Senate action, and so we also will be having Dr. Jessica Kalender-Rich, a member of the National Coronavirus Commission for Safety and Quality in Nursing Homes. But first, Doc Hawk,
yes.
How are we doing?
The numbers, I mean, I think they're pretty good.
They aren't bad.
They aren't bad. Overall, 112 in the hospital. So, we were at 120. Previously, we've been up to 180, 170.
Yeah.
Currently, 60 acute infections with really 11 of those in the ICU, so a smaller percentage, but unfortunately, 10 of those on the ventilator. We still do have 52 in that in that recovery period and 5 on the ventilator. So.
How are things at Hays?
Hays has 16 with 12 active infections and 4 in that recovery period as well. So their numbers are going down. Again, if we can continue to get those numbers down, and I'm hoping slowly as more and more percentage of the population does get vaccinated, that will decrease overall. But I think we've certainly been a lot luckier than, for instance, LA County. I think we should be thankful for that.
I think that's due to some outstanding folks out here in our community who have done a great job of helping us follow the rules of infection control. It's made a profound difference, and I think we'll continue to do so. And I'm encouraged by the local numbers on the new test positivity rate, because that's been dropping a little bit as well. The total number of new patients who are testing positive here throughout the state of Kansas and nationally is declining, and I really like that, because that portends great results, and hopefully it'll continue. The variant, it will be the wild card for us.
I think so, and I think there will probably be more, but as we've heard Dr. Norman talk about yesterday, and we've seen in the articles in the mainstream media, there will be more genome sequencing. We'll be able to hopefully identify those.
Yeah, they mentioned that from the prison yesterday. Yeah. So you had a big deal yesterday to you. You got shot number 2. Yeah. You did not throw away your shot. How you feeling?
No. I feel good. My shoulder does feel better. Probably hurt the most, about midnight last night, and has gotten better since. Just a little bit fatigued, but otherwise feeling good. Fevers, chills, nausea, anything like that? No. Doing all right? Doing good.
Awesome.
Doing good.
All right. Well, we have the shot there with Adam Meyer giving that vaccination, and we're delighted you're back and feeling well. He's happy. He's been vaccinated, and other cool stuff's going on.
I will continue to wear my mask and distance and not meet in groups, and hopefully by 2 weeks from now we'll have maximal immunity.
Yeah, that is the best. All right. Well, Senator Moran, welcome back. Again, thank you for your service to our state and to our country, and we're delighted to have you back.
Doctors, good to be with you.
You were here on Friday to tour the newly opened public COVID-19 vaccine clinic here, and you've been touring around about the state. Tell us a little bit about what you're seeing out there. What are you learning? How do you feel about things?
Well, I've been in the nation's capital most of the days during the week, but I've captured a couple of Monday mornings and a couple of Friday afternoons in Kansas, mostly focused on the vaccine. And I've been to a couple of hospitals in the Kansas City area and a couple of hospitals in the Wichita area and one rural hospital. In all instances, visiting with the nursing staff, the administration, and often some patients who are there receiving the vaccine. First of all, I would tell you that those who are there receiving the vaccine are so grateful. It is, one of those inspiring moments in which people believe that they have an opportunity to return life something closer to normal. When I was in Kansas City at KU Health System at the vaccine clinic, one of the ladies who just received a vaccine was indicating, this is about me being able to hold my grandchildren. So there's a lot of real interest, a lot of real desire, and this vaccine creates hope. In my view, it is the biggest shot in getting us back to normal, or something closer to normal, that's out there. And so I've certainly been promoting the value of being vaccinated. And I would say that there's an overriding, wherever I was in Kansas talking the vaccine, whether it's public health officials, community health centers, hospital, the the complaint, the concern is the lack of transparency, the lack of understanding when the vaccine is going to arrive, how to plan and to coordinate the arrival of Kansans to be vaccinated, just the inability to know how many doses are available, when they're going to be available, questions about why did someplace else get this number and we got that number, a lack of ability to understand what the logistics of providing vaccines are, the inability to notify people maybe till the day that the vaccine arrives in that community, at that health department, at that vaccine clinic, knowing that morning that then you've got people lined up. And then I think the second thing is we just need a lot more of the vaccine. And the president announced yesterday an increasing amount of the vaccine to be available. The lack of transparency is not just in Kansas, but it's in Washington, D.C. I think the unanswered question is, what is the capacity of those who manufacture Pfizer and Moderna to manufacture more? And that's a quest that I'm on, trying to see if the problem is we need greater manufacturing capacity, or is most of the problem just in the logistics of getting it distributed? So while I'm pleased that President Biden announced more, in fact, I think the stated goal of 100 million doses administered within 100 days, we should double that. And if the max manufacturing capacity is capable of doing so, more is better. And then we're waiting on the FDA and the other two manufacturing pharmaceutical companies to get their approval for distribution of a couple of other vaccines that would significantly increase the supply. So concern about logistics, about lack of information, about transparency, how to plan for administering the vaccine. And then secondly, how do we make sure that the vaccine is more readily available as the logistics become better?
Yeah, I tell you, I got a 2003 Sequoia. It's got a few miles on it, but it could tow just about anything. I'm happy to go up and pick up some vaccine if there's some ready for us to distribute. So I'm here for you if you need any help there.
Doctor, I know that you're all purpose, and I appreciate that offer. and we're certainly making our services available to Kansas, the state of Kansas, to try to do everything we can to get more vaccine. I guess I should point out that the vaccine, as best as I can understand it, is distributed based upon population. And Kansas has about 1% of the population of our country. And Kansas has received about 1% of the vaccine. And the numbers are that the vaccines have been received, but about half of the amount that's been received has actually been administered. So again, a couple of issues just dominate this topic for me. Is more vaccine is certainly is better, but if we get more vaccine, are we in a position in which the vaccine goes in people's arms? And that is that's the goal. One, I think, is the manufacturing federal component, more vaccine available. The other is the state and the logistics of administering that vaccine. And if it's there, we need to make sure that we're doing the things that get it where it's actually saving people's lives and preventing the spread of the vaccine. Maybe a couple of other things before you move on to the knowledgeable people on the program on this press conference. But I am a member of a group that's been called the Sweet 16. It's 8 Republicans, 8 Democrats, looking at what the next, among other things, looking at what the next COVID relief package should look like. And my view is that President Biden's, what I guess is now phase 5 of congressional and administration response to COVID-19 is politically difficult, has got lots of things in it related particularly to the economy, some of which I think there would be broad support for, some of which are controversial. My efforts and the message I delivered to the vaccine coordinator, the COVID-19 coordinator at the White House, and as well as to the president of the President's Council on Economic Advisors, is let's move forward with the vaccine portion of the phase 5 consequence, the relief for COVID-19. It's one of my themes here, because just because we can't do everything we can do some things. And there is broad support for more money for vaccinations, more money to purchase more vaccine, more money to provide assistance to states and local units of government in administering the vaccine. And with the other things that are going on in Congress, let's do that now and then continue to work on what the next phase of economic help should look like. Because I'm of the view that the economic well-being of our country is determined by how many people get vaccinated and how quickly we can slow and eliminate the spread of COVID-19. So while we think of the vaccine as a solution to people's health and well-being, it is also a solution to the economic opportunities that Kansans and Americans can have in light of the virus and its spread. So do the things that we can do and politically agree on. One of them at the top of the list is let's get more vaccine and more arms. And we'll continue to work on trying to find the right kind of solution to help more people in regard to their economic circumstances, their financial condition, and keep businesses in business and employees employed.
Yeah, no, it's interesting because I certainly think, and we'll stay on our lane around the economic part, but the health part, no question. There are that set of people who are vaccine deniers, but man, there are a whole lot of vaccine nowers. I want it right now, and why is somebody else getting it and not me? I think I spent hours on the phone yesterday, either with political questions, external questions, or with patients trying to explain the rationale for how vaccines distributed, and so I think it is the base problem is not enough vaccine. Now, is that a question of it sitting in a shelf somewhere and not being given, or is it a production or distribution problem? From the patient perspective, it's all they don't have it, and I think whatever we can do, it would be great. In your discussions in Kansas and elsewhere, Senator, did you get a better sense of whether or not it's really 50%? Because my feeling is that there's a lot more been given, but it's been hard to register that you gave it. And did you get a sense for that?
Well, yes. I mean, that the record keeping, the submission of information apparently is different than what we would do for other vaccines. It's now two reports needing to be filed. One that was the traditional, when you vaccinate people for other things, you file this report. Now a new one. And our computers, at least I'm told, in Kansas weren't prepared, and there was no incentive, much more interest in spending time administering the vaccination than filling out the report or typing on the computer. It bothered me, of course, that it was a few weeks ago in which Kansas was indicated that we were the place in which, despite the amount of vaccine available, we were the lowest in the country for administering the vaccine. That was explained by state officials as the record keeping, the process of letting officials know that the vaccine had been administered. That makes sense to me, although the question I had was, why is Kansas last? If it's a problem of filling out the report and submitting it, wouldn't other states be in the same circumstance we are? So again, it's one of those things that we're sorting through. I want to give people the benefit of the doubt. I'm sure that record keeping is a part of it. It always is, but it's not, wouldn't be just a problem for Kansas.
Well, now Missouri's last, so we don't have to be last anymore.
We traded places. Okay.
Yeah, I think Kansas has moved up in the upper tier, but I think that it's funny because when I know what we've given is over 80 or 90% of the vaccine we've gotten. We've got the rest of it will be given by the end of the week, and so the question then is how they're handling second doses and how they're counting those, because we have second doses for people we're giving, but that's not the same thing as the first dose. That you got to get people scheduled, you got to give it in, you got to make sure you give it at the right time period. The other comment I just have is that when I talk to people out there, I just don't see a lot of first doses sitting on a shelf because everybody's running out. So this record keeping thing is critical. I think the big thing is let's get the volume of vaccine up. So let's get it distributed, because I certainly believe it is, wait for it, a shot in the arm, both figuratively and literally. Not bad for early on a Wednesday morning. And Jessica Kalender-Rich, that is nowhere. I don't think it's anywhere that it can be more important than it is to those of us who are seniors or approaching that level, and especially those in nursing homes.
Yeah, absolutely. And we have actually seen challenges in rolling it out in the nursing homes, similarly to what we've seen happening out in the community. So we finally do believe that everyone in the nursing homes have at least all been offered their first clinic of 3. So you may be aware that there was a federal partnership with CVS and Walgreens to distribute to the nursing homes, and those that allows the Walgreens and CVS pharmacists to actually come into the building to distribute the vaccine. That has gone really well. We've seen a lot of the nursing home patients and residents really take the vaccine. We continue to see some challenges in getting the staff to accept the vaccine and to understand the science behind it, but I think that will continue. And now we're hearing from community members who've started to see, I think, a light at the end of the tunnel. And frankly, now it's coming up as questions about, okay, I've been vaccinated. Can I get in and see my loved one in the nursing home? And I'll just preempt that question with, we are all waiting on guidance from CMS about that, because the regulatory body was the one that said that visitation needed to stop way back when, and has since relaxed those rules a bit. And as we see percent positivity in the counties go down, we will have the allowed visitation, but it isn't currently related to vaccine status.
Yeah, indeed. So what do we say to the 65 and above who are not in a nursing home and couldn't get the vaccine yet?
I think we say to them that it's coming. Just like has been mentioned already in this conversation, it's coming. We don't exactly know when, we don't exactly know how, but we know that it's coming. And we have already spent so long isolating, masking, doing all the right things. None of that's going to go away right away. But there's a light, and it's just really important for you to stay on top of where you can get vaccinated, to be signed up everywhere you can be, frankly, and to have your family also be watching out for other opportunities.
Yeah, and so Hawkeye, the one thing I would just say, and I know we all want to get back. I get it. Everybody wants to get vaccinated, and gosh, and should be, right? Everybody should be able to get that shot in their arm. But the concern I have is I don't want people to think that just because they've been vaccinated, everything gets back to normal. I think you're protected, or you got a lot more safety from hospitalization. But the truth is, the rules of infection control will keep you safe just as well, number one. Number two, just because you get vaccinated doesn't mean you can end those rules.
No. Yeah, exactly. I mean, we expect to continue the masking, well into 2021. The real question is, with vaccination, does it prevent you, if you do get infected, from spreading the disease and transmitting? Now, we hope that yes, but we don't know that. So it's vitally important, especially right now with such a small amount or small percentage of the general population, the mass population in the United States vaccinated. It's still going to be important to continue to do the masking, the distancing, the not meeting in large groups. And that's going to be vitally important moving forward, because just as you talked about earlier in the update, we have seen cases go down and percent positives go down. That's because it's not because of vaccination or monoclonal antibodies. It's because people are continuing, hopefully, to do the right thing, and we need to continue that process forward.
Well, Jill, let's see if there are questions from reporters out there first. I'm not hearing any. You're up.
Yeah, we have a lot of community questions. This one is for Senator Moran. Gary wants to know, the former FDA commissioner said this morning that there should be investment into retooling plants and building new plants to manufacture vaccine. Is that something the federal government should support?
Senator,
I did not know what Dr. Hahn had said this morning, so I appreciate that, but I share his view. I think one of my takeaways from the consequences of the pandemic is that we need more domestic manufacturing of certainly medical supplies, what we've been calling PPE, personal protection equipment, but we also need to make certain that we have the capability of providing the ingredients and the capacity to not only research and develop the vaccines, but to manufacture them. It is a mistake for us to have to rely on someone else in the world, particularly when this has been a worldwide pandemic. We need the capacity here. Good for the economy, but perhaps more importantly, good for our ability to better react and to have supplies available more quickly. So I agree with the former FDA commissioner, and it is something that will take investment by the taxpayers of our country, even if it means that personal protection equipment and the vaccine, the medications may cost more money, the pharmaceuticals may cost more money because they're manufactured in places like the United States, in the United States, let me say it that way. We ought to be willing to invest in that because we, in the short, intermediate, and long term, will benefit from that. So yes, I agree.
And I know we have to work together as much as we can as a world, but anytime I think you face a deep crisis, you're going to take care of your own country first. And so I'm with you. I mean, our PPE and things like that, we can't necessarily depend on everyone else to produce it for us, and vaccination too.
Doctor, when the conversation was personal protection equipment, now it seems like a long time ago, although those issues are not totally behind us. We recognized last week from a report from Kansas that there's a shortage of gloves in our state. We went to work making certain that we're doing everything to get gloves. And in fact, a day or so later, more gloves arrived in Kansas. So it hasn't gone away, but that's what we used to be, spending our time on, trying to figure out how to manufacture more gloves. What we discovered was they're manufactured in China and Nicaragua and places outside the United States, and getting them into the country was slow. And when they arrived at our borders and our ports, it was often that they didn't meet the criteria, FDA criteria and otherwise, for U.S. standards. And so we had lots of folks who were purchasing things that couldn't be actually brought to the United States.
Jill?
All right, we have a question from Channel 9's Michael Mahoney for Senator Moran. It says, what economic elements of Phase 5 should be set aside, help for cities and state unemployment specialties, when should be set aside? Mike, you might want to just grab the phone and
what
say
it sounds
your own
like is
question.
I think, or probably pursuant to your earlier comments, Senator, that he's looking to see what you thought should be set aside of the thing while we move forward with other parts.
I got it. I was watching Mike. I was thinking he was looking over my shoulder, seeing what books I read. And I think it's a pretty eclectic group of books, and almost without exception, the things that are behind me I have read, but I can't compete with your journalistic knowledge. It isn't anything specific. I mean, you mentioned a couple of things. Aid to local units of government, but particularly to states and cities, is controversial, particularly with Republicans who believe that, yes, I mean, I guess I speak for myself. There are instances in which assistance is required and should be supported, but this ought not be a bill that in quote bails out units of government, cities and states that have had fiscal mismanagement for a long time. So it gets wrapped up in this discussion about bailing out bad decisions. If, again, I've been supportive and continue to support assistance to state and local units of government that are related to COVID. I think that can be solved by providing specific assistance to public health departments, to police and law enforcement, to hospitals, and maybe we can get out of the politics of this issue by just directing the money to places that we know are COVID related, and it would be helpful to the state and local units of government in their finances to provide them the money to do the things that need to be done without the politics of this broader issue of past behavior. But my point, I suppose, is not a specific issue. It's not that I have a list of things that I would not want included. I just know, in trying to garner the votes, that there are things that will create controversy and take long time. And the Senate schedule being what it is, and the demand and necessity for vaccines, if we could prioritize something that is broadly supported and get it accomplished now, it would be a beneficial thing to the country as compared to the slow process of the United States Senate on this and many other things. We also just passed an economic package at the end of the year, and those dollars are now being distributed and those programs are being administered. Again, I have asked for an opportunity to have a conversation with the administration officials, including the two that I mentioned earlier, and that has been offered. And I had that conversation last Sunday in a conference Zoom. So I just think that there's ways that we can, a $15 minimum wage, for example, Michael, is something that is, controversial. And if we're going to spend our time debating increasing the minimum wage, and if so, by how much, it slows down the process of getting the things necessary done to get vaccines in people's arms.
Joyce has a question. Does the 1% received by Kansas include the doses the feds have allocated directly to long-term care facilities?
So how does that, so I see Jessica Kalender-Rich shaking her head. Jessica, you want to pick that up?
My understanding is that that was a completely separate allocation directly to those pharmacies that did not get reflected in the numbers directed to the states.
And well, I think there's going to be some statistical variation. The reality is that, and Jessica comment on this, that in general, knowing there'll be some exceptions, but in general, that population statistics being what they are, that those who are over 65 in nursing homes will kind of reflect the general population that you have in a state anyway.
Yeah, I mean, I think we have a very relative small number of people in those nursing facilities, and they would probably not really impact the data enough to make a huge difference. So we're just happy to see things moving forward.
So one other quick question. This is almost my own self-interest. I'm going to ask you for this. Do you find that other diseases in the nursing home, infections, heart disease, lung disease, are not as much of a problem right now with the infection control the way it is?
I think that some of the infections look different. So we haven't seen the flu outbreaks, as an example, similarly to the community that we often will see in nursing facilities during this time. But from the standpoint of other organ systems, heart disease, strokes, things like that, those are still happening. And actually what we're seeing is that people are delaying their care still because they don't want to go to the hospitals or their doctor's office. And so we're seeing that those things are still as much, if not more, of a challenge.
Well, and I think that's a really important message because, you know, we're seeing the same thing here at the hospital. Our numbers, and it's true throughout the community, it's actually throughout the country, that hospital numbers, if you subtracted out the COVID-19 patients across the country, the hospital numbers are down. And you think, okay, well, maybe part of that's infection control. Good, that's great because that means people are staying a little healthier. But also what we are seeing, people are coming in later. And at that point, things are a little more progressed, like that stroke may no longer be reversible, that heart attack may no longer be reversible. So especially around those time-sensitive diagnoses, and that has to really do with just about anything like heart disease, lung disease, stroke, et cetera. Those time-sensitive diagnoses, people are in a little more trouble when they're getting here, and I think that's a bad outcome. So be careful being afraid, right? Be careful being afraid. It's right to be afraid of COVID out in the community. It's not right to sacrifice your health because you're afraid to come to the hospital. Hospitals turn out to be one of the safest places there are, and you've heard me say this before. The rules of infection control are proven every single day, people, because why? Because we don't spread COVID inside the hospital. You're far more likely to get it at the grocery store than you are at the hospital. We don't spread COVID because we follow infection control. You're going to be safe. So don't let your heart attack progress. Don't let your stroke progress. Don't let that breast lump progress, waiting to think things are going to be safer tomorrow. So, okay. I'm done preaching for a minute.
Well, can I just add to that? I think the same is true for home health coming into the home and other caregiver services coming into your home. It's really important. You know, those folks are also doing the same things we're doing in the hospital, right? They're wearing PPE. They're really following infection control practices. And it's important that we not delay them coming in and helping prevent rehospitalizations or prevent getting our therapy and things that we need because of this fear.
Yeah, fear can be a powerful thing, and sometimes it's your enemy.
Mary has a question for the senator. She says Catherine Satterwhite with HHS and others have told people go wherever you can go to get the shot. So she wants to know, Mary, Senator Moran, do you have a suggestion for allocation of vaccine on a basis other than population, since people are not staying in their counties or their states and they're going wherever they can?
It's an interesting question. Senator, thoughts?
It is a great question. I'd love the help from the rest of you on the answer to this question. But and one of the things that the Biden administration is proposing, and now that's not even the right word, as implementing, is federal centers for vaccination across the country. So in which, in some fashion, somebody related to the federal government is providing the vaccine in a facility in places across the nation. And so they're trying to increase the opportunity. I don't know. I suppose the answer to the comment about get it wherever you can get it perhaps is right, but it just demonstrates how disorganized and lack of how little transparency there is in the process that we have now. That ought not be that we have a fallback position, which is get it wherever you can get it. It ought to be that the system that we put in place in which the vaccine is allocated to the states distribute it, create the priorities, and public health departments and others then administer the vaccine. When I was in Hays, for example, it wasn't just the public health department. It was the public health department, the community health center, and University of Kansas Health System, HaysMed, that had combined their resources, created a vaccine clinic, and were putting it together. Those kind of things make a lot of sense to me. And I would think rather than saying get it wherever you can get it, the better answer is let's get more vaccines into the supply chain so that we can follow kind of a more orderly, prioritized system that, again, I'm answering your question to the best of my knowledge off the top of my head, what I think the answer is, but I'd be glad to have some help from those who are in the business of trying to make sure this process works.
I think it starts by understanding what was the context of her quote. We have talked about here on the update, okay, I think there's a three-pronged approach you can get it. You can get it at the health system, where you get your medical care. Look at your county health department, and then hopefully when these other entities, these commercial pharmacies come through, CVS and Walmart, for the general population, get it there. So I think we have to understand exactly what the context was, but also understand that I'm quite certain there's probably been some Missouri or Jackson County residents who have gotten it here because they're patients here and they were randomly allocated it. But, is there somebody from Hays who's driving into Colorado or Denver to get it, maybe because they had a bigger allocation? That's not clear. We've heard stories about people doing that, and that's not just for vaccines, but that's for other medical care as well. It's probably a small percentage of people that would do that or have the ability to do that. So I think just kind of understanding the context, and I don't know that we understand the context of what she said and why she said that quote, but we have talked about get it where you can get it in the context of your health system or your health care provider, your county health department, and then hopefully these other commercial pharmacy entities as well.
Yeah, I think that's right. Here's my answer, Senator. I think the answer is E, all of the above. In a place like a small community or a lot of counties, there may be one or two public health officers. They're not going to be able to put together a mass vaccination clinic for that area. And in some county, the population may be sparse enough. I was reading a fly fishing article last night, shocker to everybody, where the county in Montana had like 2 people in it per square mile. Well, you're just not going to have a mass vaccination. But I think what you cited in Hays is exactly right. In some places, the health department and the hospital, in this case, a tertiary referral place like Hays and the FQHC can come together and put together a mass vaccination clinic or clinics and help a whole community of people. And I don't think in that situation you want to think too hard about respecting county borders. I think at that point, let's just get people in and get them vaccinated the best way we can. And border, smarter. Just get the people vaccinated. You come to Kansas City, you say, okay, well, you got a bigger health department with Wyandotte and certainly with Johnson County. The other hand, you got a couple of really big hospitals, and you got a lot of pharmacies. You know what? We're all in it together. These folks they've never really organized a major healthcare delivery operation, but the hospitals have. So let us do that for you. Let us do the patients, or let you guys go do the people that we can't reach, or let's figure out what each party's sweet spot is, and let's get shots into arms. What I'm afraid of sometimes is that false pride enters into the story, and somebody says, I have the vaccine and I want to give it. Okay, well, that's great, but if you've never done it before, Godspeed to you. But the reality is we should be getting the vaccine in as many people as much as we can. Right now, we don't feel that problem quite as much because there's not very much vaccine. But in a few months, and especially if Johnson & Johnson and AstraZeneca hit, the question of delivery logistics is going to become a lot bigger because you're going to have a lot more vaccine to give, and you want to give it as rapidly as possible. And my plea at that point is it takes all of us to get this done. Don't base this on pride. Base this on who can get the vaccines completed as rapidly as possible. I think Hays is a great example of how to do it right, Senator.
give you a couple of observations. One, what Steve just said was something he told me when I visited with him earlier.
I may have said the same thing. That's true.
But the audience is much broader today, and it is something that really stuck with me. If we're having the challenges now in the distribution, the transparency, the logistics, what happens when we have a huge supply or a much larger supply of vaccines available? We need to get the system worked out so that when it's being available to broadly, it's not as complex and convoluted. Secondly, Hayes, in that conversation, they were making the case that was made here. HaysMed was saying in particular, a lot of the patients that we will see in our hospital come from surrounding counties where there's a smaller number of people, fewer doses, and we want to be administering that vaccine to any of our patients, regardless of what county they live in. And it might be beneficial. Again, this is a more local issue than I would solve in Washington, D.C., but the county health departments in smaller counties may be pleased to have the help from the circumstance of HaysMed. And then finally, maybe to Dr. Kalender-Rich, I read and understand, had conversations with my colleagues from West Virginia, which gets high marks in the vaccine distribution. And it was in part based upon their ability to use pharmacists and pharmacies across their state, not limited to the couple of a couple of the larger pharmaceutical, that's just the way I say it, a couple of larger pharmacies. So we've talked about who's vaccinating in the nursing homes, but it seems to me there's an opportunity for the local community pharmacist, again, particularly in rural places where there may not be a Walgreens, that we have the opportunity to increase the availability of the vaccine to a lot more people by determining how we can engage more pharmacists and pharmacies.
JKR?
The KDHE actually has a site where local pharmacies, in addition to larger corporation pharmacies, can actually sign up to be COVID vaccine distributors in the same way that they are flu vaccine distributors and other vaccines. And so that process has been underway, and it's my understanding that the state is collecting all of those names so that when and as more vaccine becomes available, it can be distributed both through the big box pharmacies and through those local groups.
Okay, thank you.
It takes all of us, right?
Yep.
At the end of the day, we just got to work together. It takes all of us, and let's get the vaccine and the people that do this kind of stuff all the time.
Let's wrap up with 3 questions on masking. A lot of people have questions about mask. One of the questions is, if the lower case count is now, why, when the masking was ramped up in October and November, why weren't there lower cases then?
Okay.
Okay, and the second
We got that.
mask question, yeah, I thought you would. Second mask question, they want to know what Senator Moran would say to the counties in Kansas who are not advocating masking. And the last mask question is, there's talk today about double masking. They want to know what you guys think about that.
Yep. Well, Hawkeye, the first part of the question is we know the answer to, right?
Yeah.
People weren't masking as much in October, and they certainly didn't until after Thanksgiving when I think folks got scared, and then they started masking on, and all of a sudden the numbers started becoming a little more stable. I think it's all about that.
Yeah.
And I think what we know is when you don't mask, you spread the disease. When you mask, you spread a lot less.
Yeah, and I think it's been the culture change. And it was easy, for example, in the summer at a tourist place, for like when I was in Colorado. So they really embrace that masking culture. And I think it's just, as we have said before, COVID is really a local entity, and you have to understand the infection dynamics there, but also the cultural dynamics. And by that, I mean like masking culture and not meeting in groups, doing those non-pharmaceutical interventions. So I think it's not just one thing, masking, it's everything. But I think the culture has evolved, and we are doing much better now overall as a general population than we were in October, November.
Senator, what do you think about masking in those areas that the people don't want to mask?
Well, my view is that certainly local officials are responsible for making good decisions on behalf of their constituents, and I leave that to them. But what I would say is, even if you are in a county that mask requirements are limited, this doesn't change your personal responsibility to wear a mask, to distance, to avoid crowds, to not have the family gatherings. to not have people together at the holidays. This can also, regardless of what's decided in a county courthouse or a county health department, we are Kansans who care about each other. It's the nature of who we are. We rally to people's causes when they're sick. We can rally to the cause of keeping people from getting sick and avoiding the virus by doing the things that, even though government may not tell us to do, we can do. And it's wear the mask, socially distance, wash your hands, all the things that we have been told. And it's the character of Kansans to do that. And I just would encourage them. I certainly want public officials to make wise decisions for their constituency across Kansas in every county. But if at every opportunity, regardless of what government says, we can do this. And I would promote that people wear the mask and distance and take care of themselves, their families, and their neighbors, like we do in so many other circumstances.
You're hired, Senator. You're hired. We got you. JKR, any thoughts about the masking questions?
I think to Dana's point, the culture of masking has really changed, and it feels more normal to us. I'm not going to say I still don't sometimes get in the car, drive down a block, and have to turn around and come back and grab a mask. But I think that we are all sort of seeing that better decisions can be made. Masking is really important, distancing, and just keep on keeping on. That's I think where we are.
What's the third part of that
And the
question?
one was on double masking, especially
Double
with the new
masking,
strain.
Hawkeye, what do you think?
So I think this came up really because Dr. Fauci was interviewed, and he said, and to paraphrase what he said about wearing two masks, he said it makes common sense. And I mean, what we have talked about initially since masking is that masking provides a barrier protection for you as the wearer, so you're not transmitting the virus into the environment. Now, it does also add or give the wearer some protection as well from preventing the virus to come into their upper respiratory tract. So I think we start with one mask, because although the masking culture has gotten better, there are still some people who are mask deniers and who don't want to do it. So start with one mask. I would not discourage somebody from wearing two masks if you can tolerate that. It certainly does make common sense. If one can filter out particles at 50%, maybe there's a synergistic effect by having two masks on as well. But even Dr. William Schaffner out of Vanderbilt, who's one of America's top ID experts, was interviewed about this probably a week or 10 days ago. And what he said, too, is, you know, the same thing. It's just there's not any data. There's not a lot of data behind that. Now, again, to go back to Dr. Fauci's words, it probably is common sense. If you can tolerate it, we're certainly not going to discourage it. I'm currently only wearing one mask. I'll probably continue to do it right now. We would certainly like to look for more data. But if you want to wear two masks, if that makes you feel better and you can tolerate it, I don't have a problem with that.
All right. Before we get to final thoughts today, just a reminder that tomorrow, Dr. Kevin Auld, an OBGYN member and a member of the CDC Advisory Committee on Immunization Practices, is joining us. The committee has an emergency meeting at 10 a.m. this morning to talk about several things. We'll be updated about that by Dr. Ault tomorrow, including vaccine effectiveness and clinical trials. We're hoping the Johnson & Johnson vaccine may have an update. I heard yesterday they plan to submit their data to the FDA here in about within the next 2 weeks. The data is going to be published in the next 2 weeks, and they hope to have that vaccine ready, which to me says the data must be looking pretty good, because they're putting a pretty big spin on it and calling out attention to themselves. Let's hope so. Also, Dr. Roy Jensen, the director of the Cancer Center, will share news of a letter to the public going out from leading national cancer centers encouraging annual cancer screenings. We're nervous people aren't getting screened. We know that lowers the mortality rate from cancer, and we're seeing later stage cancers presenting because people are afraid. Don't be afraid. The alarming number of canceled screenings during the pandemic predicts that we're going to have an increase in cancer deaths due to breast and colorectal cancer in the next 10 years. Not the right idea. Senator, final thoughts for today?
More vaccines and more arms is my goal, and want to work with you and the other medical providers, but the people of Kansas to see that occurs, including our state officials. So just a shot in the arm, you said it well earlier, is moving us in the direction of better health and a better economy and a better life.
Absolutely. JKR, Jessica Kalender-Rich.
Yeah, and I will echo more vaccines and more arms. But at the same time, we all have to be a little bit patient, know that it's coming, and continue to do the right things while we wait.
Yeah, absolutely. You know, hopefully if Johnson & Johnson and AstraZeneca can present their data and they look like it's good and efficacious and safe, we can increase that supply and hopefully decrease that demand and get more vaccine into arms.
Had a lot of calls with patients yesterday. They're all wanting to know about that vaccine. Some people are afraid. Some people are angry. Some people are hesitant. Some people are denial. And some people just want to know why. We don't have enough vaccine yet. It's going to arrive. But in the meantime, this simple tool does not say Republican, Democrat. It doesn't say independent. It doesn't say Kansas City Chief or Tampa Bay Buccaneer. It says, I care about you. And in medicine, we've been using this tool for generations, and we use it because it works. Let's keep each other safe until we can all get a shot in the arm. Senator, thank you. JKR, thank you. Hawk, thank you. To all of you out there, thank you. Stay safe. There's still no place like home.